So going on about Marylin and her her prognosis. I'm sorry.
Yes. So we've diagnosed a patent ductus arteriosus, or PDA, most common congenital heart disease that we see in small breed dogs. The prognosis without treatment is a third of dogs can live beyond a year of age, but dogs with PDAs have enlargement. She has severe enlargement of her left ventricle. Her heart is remodeled due to this vessel remaining open, and her heart is holding more blood than normal. She's maintaining normal blood flow to her body, but what can happen with time, and it's kind of a question of when will it happen, but dogs can undergo irreversible enlargement and remodeling of their heart and develop what's called congestive heart failure, where they're having heavy breathing, panting, that sort of thing. I do have a patient, Ruby, who is about 5 years of age, that went into heart failure from her PDA, and it was very difficult to treat her. So it's medical management and treatment is possible, but usually they live to young middle age.
What's young middle age? 5?
5, 6 years of age. With treatment, so with closure, either surgical, it's interesting, if Dr. Adams does the surgery, or interventionally, which is what I do, it's a great prognosis. Dogs can have a complete reverse of their heart changes back to normal, great prognoses.
I know what surgically is. What's interventionally?
Interventionally is when we actually don't open the chest and access the heart. We use the blood vessels to access the heart. So
you
what
do a
I
catheter?
do, put a catheter in the femoral artery, and then through that catheter place a device that stays and blocks blood flow across that PDA. So there's a device that's left, but a tiny little incision in the leg, and that's it. They go home the next day. The prognosis for the success rate of that is greater than 99%. The chances of it getting infected or having a problem is extremely low. Surgery also comes with a very good success rate. It's just a little bit more invasive. So we're actually cutting into the chest and taking suture, a stitch, around that blood vessel, tying 2 sutures, tightening it down, and that's how it stops the flow that way. So both are options.
And why would you do one and not the other?
Invasiveness.
Right. I mean, this was why wouldn't you do the catheter? No, I mean, that would be
The catheter is considered the gold standard.
Right.
Why they wouldn't is, depending on who does the surgery, it might be cheaper that way.
Oh, okay. So it would be a cost issue. Okay. Okay.
The device itself is about $900 to buy it. So that's where
before you even do anything.
Before you do anything else.
Right. And so obviously 2 little sutures is not $900. Yeah. Okay.
But
Gotcha.
the surgery is more involved, and usually the hospitalization is a little bit more involved. It's a bit more painful of a procedure. But both carry great successes, and the outcome.
Yeah, that's what Dr. Adams told me. I mean, he didn't tell me about that. No, he did. He mentioned that there's a new. I think he said there's a newer procedure where they do a catheter. But in any case, he said the same thing. He said with the surgery, it's like pretty much guaranteed.
Yeah, we've been doing the device for about 12 years.
Okay.
With great success.
Now he had said to me that, because I asked him, I said, if we don't do anything, he said the dog would probably live about 20% less long. You're saying it would be even shorter than that?
I think it'd likely be shorter than that. We have no studies. So
right, that's all just...
Put a number,
Is
so
there any non-surgical treatment? Like, for example, medication? It doesn't help stop it?
People, if they have a 1 to 2 day old baby that has this, they can give certain medications to physiologically close it. But once a dog is greater than a month of age, nothing will work medically.
Okay. Yeah, the one they give for heart murmurs, what's it called? The medication. It's really common.
Pimobendin?
That's it. Pimobendin.
Yeah, that's
it doesn't do anything. Yes. Okay. Yeah. Gotcha. No, they gave her that, the first doctor that diagnosed us with a heart murmur.
Oh, yeah, no.
Yeah, but,
that's not necessary.
Yeah, so there's nothing like that would, there's the only medical treatment is the procedure.
Yes.
Okay, gotcha. All right, perfect.
That's it.
And just to summarize, without the procedure, your opinion is she probably lived to be maybe 5 or 6 at best. And what would happen is that she would eventually develop congestive heart failure, which would be untreatable and would result in death.
Most likely.
Okay.
So we can treat it for maybe 6 months, whereas most dogs we can treat longer. With this, it's a.
And at that point, it would be too late to do the surgery.
it would be high risk to do the surgery.
Right, okay.
Yes.
Yeah, got it, so it needs to be prevented. She's about 2 years old now,
Mhm.
this is a guess, she was
Yeah.
found stray. Would you say that, you think, I mean, just look at her,
Yeah,
yeah.
it's interesting her cataract that she has.
I know,
So that's
right?
a little
Yeah.
unusual.
Weird, but like her teeth and everything else.
But
okay.
Yeah.
I took her to initially with a thought
Mm.
she had the molar, said there was a scar on there, and she thought she may have got a cat.
Sure.
Oh,
cat.
okay.
That's what.
Okay, Mary, we're gonna stop